So we have here, which of the following, that's for section A, which of the following, which of the following statement about the characteristics of pain associated with myocardial infarction is not true? Right. Myocardial infarction is actually a disease condition that comes as a result of most often at time it occurs when oxygen or rich blood supply with nutrient is not supplied in some regions of the heart through the coronary artery or the coronary veins. That's coronary arteries because they carry nutrient. And so normally at times when you start feeling the pain, it doesn't the pain is persistent. It doesn't subside unless you take medications to calm it down. And most often at time, it may present as even angina, partial angina. So that's it. So a squeezing or achy sensation in the chest. That's one of the symptoms of myocardial infarction. B, pain usually diffuses or radiates to the arm and spreads to the jaw, neck, and back. Yes, that's true. Pain changes with position. No, whether you lie down, you stand up, you turn left, they raise your leg up. So long as you have myocardial infarction, the pain will continue because the pain is radiating, it's coming right from the heart. So it doesn't matter whether your position is changed or not. Question two, the most common type of hernia occurring in children is the most common type of hernia. Hernia is the removal, like when an organ leaves its region of origin to another region. It causes, that's what hernia is. So hernia is a situation whereby an organ leaves its destination where the organ is supposed to be. It shifts to another destination. For an example, the intestines going to the groin, it causes hernia, right? The stomach going to down to the abdomen causes hernia, right? That's a hernia. The intestines bulging through the umbilical cord, that's called hernia because it's not found at the region or where it's found, or the membranes that are supposed to protect the organ in that particular region have been weakened, or they have failed, or they have been destroyed. So it results to hernia. So most often at time in little children, there is always umbilical hernia. Why? Because the midwives or nurses who deliver the child, if they don't take care with the umbilical cord, they will not tie it properly. They will not get it at the right point. And hence you see umbilical cords are setting in. Now, inguinal hernia can occur also in children. Why? Because it could be a malformation, it could be a disease condition, right? It could be a disease. You know, when children are in the stomach, when children are still in the womb, sorry, not in the stomach, in the womb, what they drink in the womb is the umbilical, the amniotic fluid, which is not infectious. And now let's say during delivery, some accidentally got to the mouth, and then it was not properly suctioned by the nurses, and then it resulted to it went down to their stomach, to their GIT tract, which at times the GIT tract even still dormant, and then it affects the perineum, the peritoneum of the abdomen. You notice that it will weaken the peritoneum, and then intestines may find their way into the inguinal. That's possible. Inguinal hernia and incisional hernia. Incisional hernia is not possible for you to find in children. It only occurs in adult because adult must have worked, done so many things, and hence it happens. Incisional hernia and umbilical hernia is not correct. That's B. D. Femoral hernia and inguinal hernia. No. The right answer is going to be A. What is the first aid given to somebody with a gunshot on the thigh? A. Pull the bullet out immediately. No. If you pull the bullet out, the person may bleed to death. So the bullet may be there to prevent the bleeding, so that the person should be removed. It does that. The bullet should be removed in the theater. B. Arrest the bleeding. C. Rush the injured immediately to the hospital. C. All of the above. From the ABCs of first aid, right? The ABCs of first aid, we arrest the bleeding. Which of the following statement is not true about the process of incision of a nasogastric tube to the patient in an ICU, to a patient in an ICU? Which is not true. So they're asking us to give the exception, right? Now, during the insertion of an injury tube, you must measure, right? You must prepare your materials. That's a kidney dish with water, a syringe that you're supposed to use for the feeding, then the tube, the injury tube, you're supposed to use depending on the size of the patient and the size that is recommended. It could be 16, 14, 18, and all of that. Depending on the purpose of the injury tube, then with a plaster, maybe a lubricant that you lubricate the walls of the tube. You measure from the mouth to the parotid or below the ear. You measure, you mark, and then you measure down right at the xiphoid cartilage or the xiphoid process. So let's look at what a if awake, the patient should be placed in a head up position. That could be true because that's not how it's done. Measure distance of the tip from the tip of the noses to the ear loop, then to the xiphoid process, and then mark. That's true. That's what we normally do. Ask tips as tip of the tube passes into the trachea. Encourage patient to awake, start swallowing. So the only odd answer there is A. An important aspect to include in your teaching plan to patients with ARDS, that's ARDS, acute respiratory distress disease. That's what it means, acute respiratory distress disease. A. Eat food rich in vegetables and fruit. They said an important aspect to include in your teaching plan for patients with that. That's it. That's good. Quit smoking or avoid second smoking. C. Avoid blood transfusion. D. All of the above. To me, if you ask me, I would prefer quit smoking to avoid and also secondary smoking because we have said it's an acute respiratory distress disease. So even if you are giving vegetables without the person quitting the smoking, the condition will continue because that's the primary cause. A child is brought to the emergency room by his mother, who reports the child was stung by a bee while playing in the backyard. The child has an itchy rash on the face, neck, and chest. Flush skin. Breaking is labeled with auditory whistling. The medical diagnosis reads shock, right? Based on your knowledge on shock, what kind of shock will this child be suffering? If you go to the Facebook page, you will see a clear answer to that. So that normally is going to be anaphylactic shock, right? Allergic shock. Question 7. Which of the following causes of fluid volume loss is considered to be hypovolemic shock? GIT bleed, right? GIT bleed. That's the only answer. The ascites, burns, right? Which of the following causes of blood? Which of the following causes of fluid volume loss is considered to be absolute hypoglycemia? Absolute hypovolemia, right? GIT bleed is the right answer there. Bowel obstruction is not because hypovolemia, that's shock, right? What causes decreased blood pressure in neurologic shock? What causes decreased blood pressure in neurologic shock? Movement of fluid into the cells. A, that's wrong. Movement of fluid into vasculature. From the word neurologic, it should tell you of nerve cells, and so means disruption of sympathetic nervous communication. Then polyuria. So C is the right answer because we are talking, when you see the word neurologic, though at times it may be congenital, but now it's talking about neurons. So you should focus on neurons. And when you're talking about neurons, disruption of sympathetic nervous communication. What type of sensitivity reaction is anaphylactic shock? What type of sensitivity reaction is anaphylactic shock? Now, type 1 immediate hypersensitivity disorder, type 2 antibody, type 3. Now, normally at times, just from the word, right, there's a sensitivity reaction. A normal student will start just with common sense. You may not have gone to school, gone to have this, you'll be thinking of A and a D. Now, in anaphylactic shock, Anaphylactic shock occur immediately, just like the bee, right? Just like the bee, how the bee stung that the baby is immediate. It's immediate because you start feeling the you can run, you can go off immediately. So it's not going to be a cell-mediated hypersensitivity reaction. It's just common sense. There's no book that you're supposed to include there. What is a primary cause of septic shock? Septic shock. Septic means infectious, right? So the primary cause of septic shock should be infection, right? Because we have A, bleeding, we have B, medical allergy, C, infection, D, poison. So the right answer is C.